You're not alone, together we're strong.
Do high-dose IV vitamin infusions really work for breast, colon, or prostate cancer? Are you or someone you love going through treatment for one of these three cancers? This video is a little longer than usual because it's packed with valuable information. So if you're looking for answers, you're in the right place. Let's be honest, chemo, radiation, and even hormone therapy can be brutal on the body, draining your energy, depleting nutrients, and hitting your immune system hard. But there's good news. More and more people are turning to integrative support, like IV vitamin and nutrient therapy, to help their bodies handle treatment better. Receiving integrative holistic treatment, including IV therapy, does not mean that you are necessarily abandoning all traditional treatments. These infusions can help the body tolerate treatment better, reduce side effects, and speed up recovery. This needs to be used wisely and under medical care. It's one part of a broader, individualized treatment plan that, after proper testing, medical record review, and consultation with a physician, may include multiple high-dose IV therapies, specialized medical treatments, targeted nutrition, lifestyle modifications, intermittent fasting, and ongoing comprehensive monitoring. All of this is guided by an integrative holistic provider who understands both conventional and alternative approaches. You can read about other available treatments, case studies, answers to commonly asked questions, and more at findhelpforcancer.com. In this video, I'll break down several of the most common and evidence-informed IV therapies used to support patients with breast, colon, and prostate cancer. So, what are some of the most commonly used IV therapies across these three cancers? Let's go through them. High-dose IV vitamin C. This is one of the most studied supportive therapies. At high doses, typically 75 to 100 grams, IV vitamin C may help reduce inflammation, oxidative stress, and even fatigue. It's not something you can get from food or supplements. This is pharmaceutical grade and must be administered safely. That includes doing a G6PD test first to make sure your body can process it. All three cancers, breast, colon, and prostate, often involve treatments that generate a lot of oxidative stress. IV vitamin C is commonly used to help offset that. It's often given between or after chemo sessions to protect healthy tissue and help with energy. IV glutathione. Glutathione is your body's master antioxidant. It supports detoxification, especially in the liver, and helps protect your nervous system, which is especially important if you're on chemo drugs that can cause neuropathy, like taxanes or platinum agents. It's often given alongside vitamin C or a nutrient blend, and it's used across all three cancer types to support cellular protection and recovery. It's a favorite in integrative settings for nerve protection and recovery. Myers cocktail. This is a well-known IV formula that includes B vitamins, magnesium, calcium, and a moderate dose of vitamin C. It's a great base therapy for reducing fatigue, boosting immune function, and supporting mental clarity, something many people struggle with during treatment, often called chemo brain. Because fatigue and nutrient depletion are common across all cancers, this is one of the most widely used supportive infusions. Many cancer patients feel a noticeable energy boost from this blend IV B12 plus B complex. B vitamins are crucial for energy, nerve health, and red blood cell production, especially if you're dealing with chemo-induced anemia or low energy. Vitamin B12, especially in its methylated form, methylcobalamin, also supports neurologic repair. This combo is often added to a Myers cocktail or given on its own, and it's relevant for all three cancers. IV magnesium. Magnesium is often low during cancer treatment. It's essential for muscle relaxation, nerve function, sleep quality, and bowel regularity. It's especially useful for managing cramps, constipation, and insomnia, and it can even help calm the nervous system if you're feeling stressed or anxious. Again, it's a universal need across breast, colon, and prostate cancer patients. IV zinc plus selenium. These trace minerals are small but mighty. Zinc supports immune health, wound healing, and even taste recovery, which can be affected by chemo. Selenium plays a role in detoxification and thyroid function and may help protect normal cells from treatment-related oxidative damage, so it can help boost immune function, help detoxify, and supports thyroid and DNA repair. These minerals are commonly depleted during traditional treatment, so they're often added into custom IV blends across all three cancers. IV CoQ10. This nutrient supports your mitochondria, the energy powerhouses of your cells, and also offers cardiovascular protection. It's especially helpful for breast cancer patients receiving doxorubicin, a chemo drug known to impact the heart, but it's used more broadly for fatigue, muscle support, and cellular recovery in all cancer types. IV vitamin D3 plus K2. These are often overlooked in IV form but can be incredibly important, especially for bone health, immune support, and hormonal balance. Vitamin D deficiency is very common in cancer patients, and pairing it with K2 helps it get where it needs to go, into the bones, not the arteries. Low vitamin D is extremely common in cancer patients, and correcting it can make a big difference in mood, immunity, and recovery. This is especially useful for prostate and breast cancer patients who are on hormone-blocking therapies, which can increase the risk of bone loss. So again, these IV therapies are used as tools in an overall treatment plan. When used wisely and safely, they can help your body get through treatment with more strength, less side effects, and better recovery. The key is working with a provider who understands both conventional oncology and integrative care so that timing, dosing, and lab work are all done properly. If you're interested in learning more or finding a provider who can guide you, visit findhelpforcancer.com or give us a call at 928-546-5963. We're here to support you every step of the way. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.